notes. We do have the Spanish language channel available if you want to change your channel settings, as well as if you want to change the way the video looks. You can use that gray bar on the side. And with that, we'll get started. So welcome, everyone. Thank you for joining us for our COVID-19 media update. Today, we have Nisha Alden, Respiratory Disease COVID-19 Surveillance Manager for CDPHE, Scott Bookman, COVID-19 Instant Commander for CDPHE, and Heather Roth, Immunization Branch Chief, Division of Disease Control and Public Health Response for CDPHE. And with that, I'm going to send it over to Nisha.
Good morning, everyone. We wanted to give you an update on how our case counts and hospitalization rates are going. So on this graph, you can see that we are continuing to decline. Our 14-day case rate per 100,000 people is declining in every age group, especially in the 11 to 17. We see a pretty steep decline, but it's nice to see it happening across the board among all age groups. Next slide. Here you can see that we currently have 396 patients hospitalized with COVID across the state. That is also continuing to decrease. Another good sign that we're doing a good job with vaccination of controlling COVID-19. Next slide. This slide shows the correlation between 14-day COVID-19 hospitalization rates and up-to-date vaccination rates. So if you can see along the left y-axis, that is the rate of hospitalizations over 14 days per 100,000. So, and across the bottom is the share of the total population that is fully vaccinated. The line shows that as more people are vaccinated in a county, the rate of cases over 14 days continues to decline. That is exactly the direction we want to see. It means vaccination is working in decreasing cases. Next slide. We still have vaccine breakthrough cases. This is not unexpected. We see vaccine breakthrough cases, and as we see more people who are vaccinated, we will see more cases who are vaccine breakthrough. We have recorded a total of 2,916 breakthrough cases, but that is only 0.1% of all vaccinated Colorados as of this morning. We have not identified any cases that we we have not identified more cases than we would have expected given current vaccination and transmission rates. For comparison, we have had 100,068, 944 overall reported cases since January 15th. And as you can see on this slide, these numbers are also since January 15th. So this is a very small proportion of all the vaccinated cases and all the vaccinated people and all the cases that we have across the state. And that's all I have. I'll turn it back over to Heidi.
Great, thank you. And so now we'll go ahead and start with our Q&A portion of the presentation. For this, we'll use the raise hand function, and I would love to call on everyone's first questions first. So if you have follow-up questions, we'll get to those second, but I want to get through everyone's first questions first. And so with that, I'm actually going to start with John Daly. And if you could say your name and the outlet that you're with.
You bet. Hi there. This is John Daly with Colorado Public Radio. Thanks so much for taking our questions. I have a question. I think this would be for Scott, but anybody's happy or welcome to answer. I wanted to ask if you think that it's possible for Colorado to get to the community immunity level of 70% if we don't get to a similar number amongst the Latino community, where we know their numbers are lagging other groups, as well as, I guess, other parts of the state that are not there. But specifically with the Latino community, can we get to that goal if we don't get to that goal within that group?
It's a great question. Thank you. And we have seen Coloradans come together over the last almost year and a half now in every aspect of our response to this pandemic, whether it was social distancing or mask wearing. And now as we move into this phase of our vaccine work, we really are continuing to see Coloradans come together. And we are seeing people who are excited about getting this vaccine. We also see people who have some hesitancy. And we are really, working across the state. It's an all-state effort between, CDPHE, between the Unified Command, our local public health partners, and all of our providers to ensure that there is access to vaccine for all, and to ensure that we are doing all the communications, and whether it's in Spanish, on Spanish media, on our social media, to really ensure that everyone is aware of where they can get this vaccine, that they understand that it is safe, and that they understand that it is effective. This is how we get out of this. And we're going to continue to do all that we can to ensure that everybody can get this vaccine.
Great, thank you. Jessica, we'll go to you.
Hi, I saw where some states are concerned that their supply of the Johnson & Johnson vaccine is going to go to waste if it's not used soon. Is Colorado concerned about this as well? And if so, how many doses are at risk of going to waste?
This is Heather. I can take that. We do have some J&J in the state, approximately 30,000 doses kind of scattered, at retail pharmacies, at some of our community vaccination sites, at our state lab, and at vaccine providers. I think the big message here is that we're working together kind of as a provider network, right, to minimize losing any expired doses of any of the 3 authorized COVID-19 vaccines. And this includes moving vaccine post-expiration from one location to another so that they can get into arms. And so I don't know that we're super concerned. We're pushing vaccine out as quickly as we can, and we're not missing any opportunities to vaccinate when people present and have made that decision to take the vaccine.
Great, thank you. Chris.
Question for Scott. This is Chris Vanderveen with 9 News. I'm assuming, Scott, you don't want to be the COVID-19 incident commander for a long time moving forward, but we've now entered this phase where it seems like, we're gonna hit our ceiling with vaccinations. The number of people getting vaccinated has gone way down, at least the rate. And so do we expect the next, 6 to 12 months to sort of be this period where COVID is percolating in communities with less vaccination? It's going to kind of rise and fall, and it's just really not going to go away for the next year? Or do you envision a time when it just goes away in the next year?
A great question, Chris. And, I have another title in addition to being the incident commander, which is, overseeing our Division of Disease Control and Public Health Response, which really does encompass all of this work. And that's why I've been in this role, but your question isn't about me. Your question is really about the next trajectory here. And, we are continuing to look and to see what the future will hold. We know that high vaccination rates are key to keeping disease rates low. And so, the key effort here is to continue to expand our vaccine efforts, ensure access to all. We are going to make sure that there is continued access to community testing. We are going to continue to make sure that we have the best data available coming from our epidemiologists. We'll continue to monitor our healthcare system. And, we do need to keep an eye on, what this will look like as we go into the fall. And we are looking at national data. We are looking at international data. In an ideal world, COVID would, disappear. I don't think that we have the luxury of that happening anytime in the near future. And so we're going to continue our focus this summer on getting those vaccination rates up. We're going to do some planning for the fall to make sure that we're prepared, and we're going to continue to monitor the situation.
Great, thank you. Does anyone have any additional first questions before we take it over to follow-up? John Ingold.
Yeah, thanks. It's John Ingold from the Colorado Sun. I'm wondering on those vaccine breakthrough cases, are there any trends that you're noticing within the groups in terms of age demographics, where they're occurring, anything like that?
So far, no, we haven't identified any trends. They seem to be just, across all age groups, among vaccinated people, so really 12 and above. And we have not seen any trends. We are continuing to watch and sequence all of these cases at our state lab to make sure that there's no variant breakthrough that would indicate anything such as decreased effectiveness of the vaccine against a certain variant. We have not seen that. Right now, the vaccine is effective against all variants, and so we are continuing to monitor that.
Do you notice any trends specifically with the severe cases, the deaths, the hospitalizations, or are those among more so older folks, or who are those people?
Yes, the hospitalizations and deaths follow kind of our normal pattern for COVID, in that they are among older adults. They have multiple underlying health conditions. COVID is one of the causes of their death, but not always the primary cause of death or hospitalization.
Okay, thank you.
Great. Chris, back to you.
Is there any way to calculate better? We get a lot of talk about the breakthrough cases. This is a little bit of a follow-up to what John had just asked. Is there any way to get a better idea of a point in time? Like today, we have roughly 400 people in Colorado hospitals who are COVID positive. Of those 400, how many of those are vaccinated versus non-vaccinated? We get a long list of how many people have breakthrough cases since the start of this, but what we don't have is sort of breakthrough. Are we seeing breakthrough cases right now? And can we look at, of the 400 people who are in the hospital right now, 5% are vaccinated, or 2% are vaccinated, or 20% are vaccinated, or 50% are vaccinated? It'd be helpful to give us a better snapshot in time as to what's taking place now, as opposed to what's taken place in the past, if that makes sense.
It makes a lot of sense. And I wish I could say, yes, we can do that. Unfortunately, it's very hard to get data due to reporting lags, get the hospitalization data and the vaccination status all at the same time. We can look at it and get back to you with more information, but it's very hard to get those data to happen at a point in time, knowing who's hospitalized right now and what their vaccination status is. We usually have to do a medical record review to really look and see who is vaccinated among those hospitalized cases. So
Horrible
lag.
Horrible follow-up, but would it help if the Colorado Hospital Association, if for me to kind of nudge the hospital association and say, hey, it's because it seems like most of the hospital systems are keeping track of this data. It's just not going into one central place.
Yeah, I think you're right that the hospitals do have the information likely in their clinical notes. I think it is hard to get it all in one place. I think we have the information, like I said, but it's probably delayed on the public health surveillance side.
I'm going to be doing more nudging.
Great, thank you. Any other questions for today? All right, well, if there are no further questions, and if you think of your questions later, please feel free to send those to media_info@state.co.us. And thank you for joining us for our quick update today, and we hope you have a great rest of your day.